Do you frequently feel like your heart is pounding, or you're suddenly out of breath for no reason? Or maybe you've had a clot in your leg that came out of nowhere. What if I told you your own immune system might be mistakenly causing these problems? That's what happens in Antiphospholipid Syndrome, or APS. It's a condition where your body produces antibodies that attack normal proteins in your blood. This causes your blood to clot too easily. Think of it like a car's brakes getting stuck. Your blood, which should flow smoothly, suddenly hits the stop button too often. These clots can lead to serious problems like strokes, heart attacks, or issues during pregnancy, like miscarriages. So if you or someone you know has unexplained clots or pregnancy losses, APS could be a hidden culprit. Great question. Normally, your immune system fights germs like viruses and bacteria. But in APS, it gets confused and attacks harmless proteins in your blood that interact with fats, called phospholipids. Scientists still don't know exactly why this happens, but it's like your body's security system starts attacking its own workers instead of the burglars. Sometimes APS shows up alone. That's called primary APS. Other times, it appears with other autoimmune diseases like lupus. That's secondary APS. It's also possible for infections, medicines, or even genetics to play a role. Imagine your genes load the gun, but environment pulls the trigger. Things like smoking, being inactive, or having surgery could awaken the condition. So while we can't always stop it from starting, knowing the causes helps us manage it better. Now, how do you know if you might have a PS? Here's a quick quiz. Have you ever had a deep vein thrombosis, like pain and swelling in one leg, especially the calf? That's a classic sign. What about unexpected headaches or seizures? Some people with a PS get these because tiny clots affect the brain. Women might notice repeated miscarriages, especially in the second trimester, heartbreaking and puzzling unless a PS is checked. Others develop a red, net-like rash called livedo-reticularis, often on the knees or arms. And some people feel tired all the time, lose hair, or have frequent nosebleeds. But here's the tricky part. Many people with a PS have no symptoms until a clot happens. That's why it's often discovered after a scary event, like a stroke in a young person with no risk factors. If this sounds familiar to you or someone you care about, it's worth exploring further. First, they listen to your story like, have you had clots or lost pregnancies? Then comes the blood test. They check for 3 main antibodies: lupus anticoagulant, anticardiolipin, and anti-beta-2 glycoprotein 1. But here's the catch: these must be positive in 2 tests, taken at least 12 weeks apart to confirm APS. Otherwise, it could just be a temporary reaction. Imagine testing your car engine only once when it sputters. You need to check again to be sure. Once diagnosed, treatment usually means blood thinners, like aspirin or warfarin. Think of them as oil for your engine. They keep your blood flowing smoothly. If you've had clots before, you might stay on them long term. For pregnant women, doctors often add heparin, a safe in pregnancy blood thinner, to protect the baby. Treatment isn't a cure, but it's like wearing a seatbelt. It greatly lowers your risk of serious harm. Can you prevent a PS? Well, you can't stop your body from making the antibodies, but you can prevent clots, the real danger. Quick self-check. Do you sit for hours watching Netflix or working? That inactivity raises clot risk. Stand up, stretch, walk every hour. Drink water. Dehydration thickens blood, like leaving juice in the sun until it gets sticky. If you're on birth control pills or hormone therapy, talk to your doctor. These can increase clotting risk in a PS. Avoid smoking. It's like pouring sand into your blood vessels. And always inform doctors about your condition before any surgery or long trip. You might need preventive shots or socks. Prevention is about smart habits. Think of your body like a garden. With good care, movement, hydration, no smoking, the weeds, clots stay away. Scientists are working hard to understand why the immune system turns rogue. One exciting area is biologic drugs, medicines that target specific immune cells causing the problem, like sending a sniper instead of a bomb. Trials are testing drugs like rituximab or eculizumab, especially in tough cases. Another cool advance is better tests. Researchers are developing faster, more accurate blood tests that could catch APS earlier. Also, there's growing focus on seronegative APS, people with symptoms but negative blood tests. New tests may soon detect hidden antibodies. And for pregnancy, doctors are studying if adding low-dose immune modulators helps more than blood thinners alone. Imagine a future where we don't just treat clots, but fix the immune mistake itself. That's the hope, and science is getting closer every day.